It's also important for everybody to know that when you get to age 65 and you file for Medicare, you're going to be Medicare A, B, and D. There's 3 different parts to it. They cover different things. And without getting too detailed about that, just know that even if you have all 3 parts, you are going to have to pay premiums, okay? It's not all free, so that you're going to pay for that. Your premiums are income adjusted. So if your income gets too high in retirement bill, they're going to increase your premiums. And so that's important to understand. The details, again, not going to get into the finer details of that. If you want to get into that, you can give us a shout. We'll go through that with you as well. But that once you understand what it does cover and what your premiums are, then it's important to understand what it doesn't cover. And if you need or want to cover in some of the gaps, I think of Medicare like Swiss cheese. There's holes. And there are plans out there, Bill, that are designed specifically to fill in the gaps or fill in the holes that what traditional Medicare doesn't cover. And there's really 2 kind of paths you can go down there. There's the original Medicare path, and to get a Med Sup plan. It's a supplemental plan that covers a lot of what Medicare doesn't. Now, it doesn't mean that you'll have 0 out of pocket or 0 copays, but it just covers a lot of those big kind of donut hole catastrophic type things. Or there's a whole different route you can go called Medicare Advantage. And again, without getting into the finer details, this comes down to one of those situations, Bill, where you don't want to be the perfectly average and just do what your neighbor is doing. What you want to do is go in and talk to somebody that is a specialist in this area and tell them exactly kind of who you are from a health perspective. Everything from, past health experiences, are you healthy today? What prescriptions are you currently on? Surgeries expected or had already, where you currently doctor, where do you want to doctor, like all that kind of stuff. And based on all that information that's specific to you and your family is going to determine what Med Sup plan you should have, or if you should go the other route with Medicare Advantage. But then once you've got that done, what you should know after that, Bill, is where your exposure is. At least on things like doctoring, physician's visits, lab work, procedures, things of that nature.
Right.
Because that shouldn't be an unknown. You should know that, look, as I go throughout this year, here's the premiums I pay for my original Medicare and any supplement plan or Medicare Advantage I have. And here's what my copays are going to be and my max out of pocket. And if I know those things, I can just plan on that, and there's going to be no surprise.